Hospital Robots by Team 11086A.
Some robots work in surgery. These robots either perform surgery or make operations easier by allowing doctors to see inside human bodies and repair problems faster than human hands could. Patients appreciate their precision and accuracy. Dr. Patrick Ross, chairman of surgery at MLH, said, "Robotic surgery is currently in high demand because it is representative of the newest, most innovative technique. No one wants to consider receiving last year's best option, where there are more advanced and possibly more effective alternatives available. Robots also reduce a patient's recovery time and infection rate." The robot has been a game changer in kidney surgery, said Mayank Patel, a urological surgeon. "It allows us to do operation we used to do as open surgery through a minimally invasive route. They are now able to remove small portions of organs, leaving the rest to function normally. Also, instead of having a 15 to 20 inch blood incision, there's only a small cut of that, which means that the patients have less plain blood loss and reduces infection chance."
Although helping kids overcome fears in hospitals is important, other pediatric robots are helping kids communicate with families, doctors, friends, and teachers. Vigo Communications made a robot that gives video communication and follows them around. Vigo robots help by letting specialist doctors check in remotely, allows patients and friends to call patients, and offer words of encouragement, broadcasts lessons from the classroom for kids who are recovering from surgery, and it follows kids to class to monitor their health when they are back in school. It provides emotional support through calls from family and allows young patients to return to a normal life sooner.
Many robots help kids. They help kids before a procedure or after surgery when they are recovering. Kids are often terrified of hospitals. They're in pain and they don't understand why things are done. Robots make doctors' visits more enjoyable and reduce these fears. Some robots, like Medi, hang out with the kids in the waiting room. Medi is a humanoid robot whose only job is to make hospital visits less painful. Kids reported 50% less pain with a robot. They became less worried about the needles and focused on the robot. Some people also made these huggable and talking robot teddy bears. Kids shake his paw, tell him jokes, and play games with him. While some see a robot, kids see a teddy bear.
Robots also make cleaning hospitals easier. They make disinfecting processes smoother and more effective. They fight viruses and microbugs with ultraviolet light, doing more traditional methods couldn't. They have reduced the number of healthcare-associated infections, which reduced patient stay. A study showed that only about 1/2 of hospital services were properly cleaned. Employees spent 8 hours cleaning corridors in the lobby, covering 80% of the hospital floors per shift. Machines now cover these areas, letting cleaning crews spend 2,900 hours a year focusing on their other tasks. This isn't as exciting as surgery robots, but it saves as many lives as surgery robots.
This video was made by Team 11086A, the original Cybercats. The voice actors were Jacob McIntyre, Aiden Paris, Alex Columbus, and Andrew Way. Research was by Andrew Way and Anthony Morrison. The picture websites were the SmithsonianMag.com, RxRobots.com, RoboHub.org, SiliconHillsNews.com, and the pictures were found by Anthony Morrison. Videos were made on ShadowPuppet.edu. Thanks for listening.